Care coverage for more of Mississippi's poor. That was a big issue for state lawmakers earlier this year, and that issue is coming back again for them in a couple of months. Let's go live to WTVA's Jake White, who's in Oxford, with a look at what's ahead for those legislators.
Yeah, and you may remember what happened earlier this year when the legislator actually tried tackling this. They got to the end of the session and failed to reach a compromise to make Medicaid expansion a reality. House Speaker Jason White and Lieutenant Governor Delbert Hosemann say they will bring that subject up again when the gavel goes down to start the legislative session in January. That attempt to get expansion passed this year failed in part because House Democrats didn't think the federal government would approve a Republican proposal for a work requirement for receipts. However, the head of State Hospital Association says things may be different this time.
With the election this past week, we know that a work requirement very well may be successful in passing CMS and federal scrutiny.
The Hospital Association says it supports expanding Medicaid not only to try to improve the health care of people in poverty, it would also help hospitals cover costs for those who can't pay for treatment. Federal law requires anyone showing up to a hospital emergency room to be treated regardless of whether that person can afford it or not. Meanwhile, Governor Tate Reeves is still opposed to Medicaid expansion, describing it as putting more people on the welfare rolls. So the legislator has to get enough votes to override the governor's veto if that proposal is going to pass. Live here in Oxford, Jake White, WTVA 9 News.